Welcome to the Tenet Healthcare Medical Minute. I'm Julia Yarbo. Our topic today is headaches, and our guest is Dr. Jennifer Buczyner, a board-certified neurologist specializing in headaches and neuromuscular disorders. Dr. Buczyner practices at the Palm Beach Neuroscience Institute, and she's also a member of Tenet's Advanced Neuroscience Network. Dr. Buczyner, thank you so much for joining us.
Thank you for having me.
What exactly is a headache?
Essentially, a headache is pain in the head in varying location, quality, and severity. At times, someone may experience nausea, vomiting, sensitivity to light, and sound associated with their headache.
So what causes a headache? Is there a physiological change within the body?
There's actually thought to be a physiologic change when it comes to migraine, in that areas of the brain become desensitized and blood vessels either dilate or constrict.
So what are the different types of headaches?
Different types of headaches, the most commonly ones that we see, include migraine and tension headaches. Migraine headaches typically are located on one side, are pulsating in character, typically associated with nausea, vomiting, sensitivity to light or sound, and often patients will tell us that they're unable to do activities and just need to lie down when they have one. This is in comparison to a tension headache, which is typically bilateral in location, is dull, doesn't prevent people from doing any of their daily activities, and often does not have sensitivity to light or sound.
At what point should an individual consider seeing a doctor if they're experiencing a headache?
In the first case, if you're having more than 2 headaches per month, which are debilitating, I recommend you seek medical care. In the second case, if you're having to take whatever over-the-counter medications you're taking more than 2 days out of the week, I recommend that you also see a physician, or you may be a setup to develop a chronic headache due to overusing these medications. Lastly, if you have any of the following red flag symptoms, I recommend that you seek an evaluation, as you may have a more urgent cause of headache. Use the term first, burst, cursed, worst, and 51st. First is the first headache of your life. If you're not someone who ever had headaches and all of a sudden began, you should get medical help. Burst. This is a headache that comes on sudden and maximal in nature and can suggest an underlying aneurysm. Cursed. This is a headache where you have neurologic symptoms with it, either numbness, tingling, weakness, difficulty speaking. 51st. If you're over 50 and all of a sudden develop headaches, you should get medical care. And worst headache of your life. This can also suggest an underlying aneurysm or other brain lesion.
All right, great information. Dr. Buczyner, thank you so much.
Thank you.
And thank you so much for joining us. I'm Julia Yarbo. For more information on Tenet service in Florida, please visit us at tenetfloridainternational.com or call toll-free at 1-855-854-4868.